Hello, I'm Dr. Brandt R Gibson. Did you know that the extremities don't form in utero as the baby is developing together? They form completely separate. You have different buds that form, so each arm is developed separately, each leg is developed separately. Because of that, they're not exactly the same. If you look at your feet, you have one foot that's larger than the other. If you look at your hands, you have one hand that's larger than the other. Just like if you cut your face in half, you've got one eye that's larger than the other. This is a common thing, that you're not symmetric, you're not exactly the same. It's usually not a big deal. But in some situations, you can have a leg length difference where one leg is shorter than the other. And if you were to check it, in most cases, everybody has one leg shorter than the other. The only time it's a problem is if it causes pain. If it changes the way you walk enough that it creates discomfort, creates pain. So why would it? The ideal way to walk is land on the outside of the heel and roll to the big toe. If you're doing that, then typically the foot is functioning exactly how it's. A lot of individuals supinate, where they land on the outside of the heel and stay outside and then roll pronate right before they push off, or pronate, where they land kind of flat and then as they push off, they're pronating as well. The problem with either one of those is if you have a leg length discrepancy, you're going to walk a slightly different one leg to the other. So, for example, you'll have the right leg. If the right leg were longer, it's going to try to roll out. So it's going to supinate a little bit more, and the shorter leg is going to pronate more. So there's two different ways that can happen. That can either make you go a little bit more pigeon-toed on the shorter leg, or it can cause you to pronate more on the shorter leg, and that can cause issues. Now, leg length discrepancies are common. They don't always have to be treated. If they're creating pain, then a lot of times you can treat them with a simple heel lift in the shorter leg and fix the problem and allow you to continue to function without difficulty. In some situations, you need an orthotic that changes the way you walk as well, and you can build the lift into that. Very rarely does that change over your lifetime. I have had one patient where at one point they had a leg length discrepancy, then that leg grew quicker than the other one, and it reversed, and so the leg length discrepancy was actually on the opposite leg a couple years later. So that's always something to keep an eye on. Leg length discrepancies can be a big deal. In most cases, they're not. But if they're causing pain, if they're causing difficulties with the way they're walking, there are things that you can do. This is Dr. Brandt Gibson. This is your Podiatry Tips Day 2.